Tips for using insulin. If you've been diagnosed with diabetes, you may be wondering how to best use insulin. Here are some tips to help you get started. First, be sure to consult with your doctor or healthcare team to determine the right dose of insulin for you. Then, schedule regular checkups to ensure that your blood sugar levels are being properly managed. Finally, don't forget to take care of yourself by eating a healthy diet and getting plenty of exercise. With these tips in mind, using insulin can help you live a long and healthy life with diabetes. If you are using a new vial of insulin, be sure to check the expiration date before using it. For diabetes patients, it is critical to check the expiration dates on their vials of insulin. Expired insulin loses its effectiveness and can lead to complications with diabetes management. While the idea of checking expiration dates may seem simple enough, it is crucial for diabetes patients to make sure their insulin is still usable before taking any doses. It may be a hassle having to take extra time out of your day just to check an expiration date, but ultimately, it could make a huge difference in aiding diabetes management and avoiding negative health consequences. Insulin should be stored in a cool, dry place. Do not store it in the refrigerator or freezer. Diabetes requires careful and precise management, which includes properly storing diabetes medications like insulin. It's important to store insulin in a cool, dry place out of direct sunlight. Don't be tempted to store insulin in the refrigerator or freezer, as this can affect the potency and effectiveness of the medication. Keeping track of insulin use and storage is essential to achieving diabetes control. Speak with your doctor if you have any questions about proper diabetes management. It is important to inject insulin into a clean area of skin. The best areas are the upper arm, thigh, buttocks, or stomach, anywhere there is some padding of fat beneath the skin to help absorb the insulin. Injecting insulin is an important part of diabetes management, however, where the insulin is injected is just as vital. To get the most benefit from the diabetes medication, it's best to inject into a clean area of skin with some padding beneath it, like the upper arm, thigh, buttocks, or stomach. This makes sure that your diabetes medication is absorbed properly and doesn't become ineffective due to improper injection technique. Knowing how to safely inject diabetes medication can make all the difference in effectively managing your diabetes. Be sure to use a new needle for each injection to avoid infection, and keep track of how many times you have used each needle by writing the number of uses on the cap with a permanent marker. If you have diabetes, you know that the importance of receiving regular insulin injections cannot be overstated. Aside from the quality and effectiveness of diabetes care injections, it's equally important to maintain proper health and safety protocols for administering them. Requiring a new needle for each injection is vital to preventing infection. To help make sure this practice is followed, use a permanent marker to write down how many times a needle has been used on the cap. This way you can easily keep track of needles so that old needles are never reused. Doing so will ensure a safe diabetes care experience that helps keep your diabetes under control. After injecting insulin, massage the injection site for a few seconds to help absorption and prevent bruising. For diabetes patients who use insulin injections as part of their diabetes control plan, massaging the injection site after using an injection pen is not only important for the absorption of the medication, but also to help facilitate a smooth process and prevent bruising. By performing a light massage on the injection site after an insulin dose is administered, diabetes patients can alleviate any brief discomfort in the area and absorb more of their diabetes medication into the surrounding tissue. Taking this extra step helps diabetes patients get the most out of their insulin doses and manage their diabetes more effectively. Keep track of your blood sugar levels before and after meals, as well as when you take your insulin injections, so that you can adjust your dosage if necessary. Keeping track of your diabetes health is paramount for managing diabetes. Blood sugar levels should be monitored both before and after meals, as well as when insulin injections are taken. This will ensure that you have a good diabetes care plan, and if it is necessary to adjust your dosage, you'll be able to make the changes. Regardless of diabetes type, type 1 or type 2, tracking blood sugar levels is an important way to keep your diabetes under control. Self-monitoring is just one of the ways that diabetes can be managed. Diet and exercise can help too. If you have diabetes, it is important to be vigilant about your insulin usage and storage. Be sure to check the expiration date on new vials of insulin, store them in a cool, dry place, inject them in a clean area of skin, and use a new needle for each injection. It is also important to massage the injection site after injecting insulin and to keep track of your blood sugar levels so that you can adjust your dosage if necessary. And be sure to subscribe to our channel and check out our website for more great tips on how to stay healthy and stop diabetes.